Do you know your skin can show signs of diabetes? Yes, you heard it right. Diabetes, a condition that affects millions of people worldwide, doesn't only impact your blood sugar levels. It has the potential to affect various organs of your body, including your skin. It might seem surprising, but your skin can actually reveal a lot about your overall health, and yes, even about your blood sugar levels. From subtle changes like dark patches to more noticeable ones like skin outbreaks, your skin can manifest different signs that might indicate diabetes. And here's the important part. Noticing these signs early can make a profound difference in managing the disease. Diabetes, when detected early, can be better controlled and managed, reducing the risk of severe complications. So, let's delve deeper into this fascinating and crucial topic. Now, are you ready to discover the 8 common skin signs of diabetes? First up, we have dark patches on the skin. Now, you might think, I've got a few of those, but it's probably just a tan, right? Well, not necessarily. With diabetes, these aren't your typical sun-kissed spots. This could be a sign of a condition called acanthosis nigricans. It's a fancy name, but basically it's characterized by dark velvety patches in body folds and creases. You might notice them on your neck, armpits, or elsewhere. It's not just about appearances. These patches can be a clear sign that your body is having trouble processing sugar. So why does this happen? Well, insulin resistance can lead to an increase in skin cells, causing these dark patches to appear. It's your body's way of waving a red flag and saying, hey, something's not quite right here. So, if you notice dark patches, don't ignore them. They could be a sign of something more serious going on beneath the surface. Moving on to the second sign, skin tags. These are small, soft pieces of skin that hang off the surface like tiny balloons on a string. They're usually the same color as your skin or slightly darker. While they can appear anywhere on your body, they're most commonly found in areas where the skin folds, such as the neck, armpits, and groin. But how do skin tags relate to diabetes? Well, it's believed that insulin resistance, a key feature of type 2 diabetes, could play a role in their development. When your cells become resistant to insulin, it leads to higher levels of this hormone in your blood. Some researchers think that these elevated insulin levels could stimulate the growth of skin cells, potentially leading to skin tags. So, if you notice these little skin flaps appearing, it might be worth discussing with your healthcare provider. Remember, skin tags aren't just a cosmetic issue. Yellow, red, or brown patches are our third sign. Diabetes can cause a myriad of skin conditions, and one of those is a condition called necrobiosis lipoidica. This is a bit of a mouthful, isn't it? But let's break it down. Necrobiosis. Lipoidica is a rare skin disorder that creates shiny, reddish or yellowish-brown patches on the skin, typically on the lower parts of the legs. These patches may be small at first, but they can grow larger over time and may also become itchy or painful. What's happening beneath the surface is that the collagen and fat under the skin are being replaced by a tougher tissue. This change in the skin structure is often associated with diabetes, particularly in women. So, if you start to notice these yellow, red, or brown patches on your skin, don't brush it off as just a skin issue. It could be telling you something more about your health. If you notice such patches, it could be more than just a skin issue. Next, we have blisters. Now, blisters might seem like a common skin issue that everyone experiences from time to time, but when it comes to those living with diabetes, they take on a whole new significance. Diabetic blisters, also known as bullosis diabeticorum, can appear on the skin without any obvious cause. This phenomenon is relatively rare, with less than 1% of individuals with diabetes experiencing this symptom. Yet, it's an important sign to be aware of. These blisters often resemble burn blisters and can appear anywhere on the body, but they're most commonly found on the hands, feet, legs, and forearms. They're usually painless and heal by themselves within a few weeks. However, it's crucial not to ignore this sign. If you notice unexplained blisters appearing on your skin, it's always a good idea to seek medical advice. There could be an underlying issue that needs to be addressed, so the appearance of blisters should not be taken lightly. Fifth on our list are skin outbreaks. Now, this is something that might take you by surprise. High blood sugar levels can lead to skin infections or outbreaks. Quite an unexpected connection, isn't it? When your blood sugar levels are high, your body's ability to fight off bacteria is compromised. This means that minor cuts or wounds can lead to severe infections if not treated promptly. But how does this connect to skin outbreaks? Well, these infections can present themselves as outbreaks on your skin. These outbreaks can vary in severity and can appear anywhere on the body. They may come in the form of boils, styes, or even carbuncles. It's important to remember that while these outbreaks can be a sign of high blood sugar, they can also be caused by numerous other factors. So, if you're experiencing regular outbreaks, it might be time to look beyond the surface. Regular outbreaks? It's time to check your sugar levels. Are you constantly itching? That's our sixth sign. Itching, you see, is more than just a minor annoyance. It can be a sign of something much bigger happening beneath the surface of your skin. Persistent itching, particularly in your lower legs and feet, can be an indication of poor blood circulation, a common issue for many people living with diabetes. When your body doesn't circulate blood properly, it can lead to dry, itchy skin. It's your body's way of sounding an alarm, a cry for help if you will. It's telling you that something is not quite right. And while you can certainly try to alleviate the itch with creams and lotions, it's crucial to address the root of the problem. So if you're constantly scratching those itchy legs, it might be time to consult a healthcare professional. Don't simply brush it off as dry skin or an allergic reaction. Persistent itching should not be ignored. Shin spots, a little-known seventh sign. Now let's talk about something you might not have heard of before: diabetic dermopathy, better known as shin spots. These spots appear as light brown scaly patches often found on the front of the legs, particularly the shins, hence the name shin spots. They are typically round or oval and could possibly be mistaken for age spots. But they're more than just a cosmetic inconvenience. Shin spots are actually caused by changes in small blood vessels, a common occurrence in people with diabetes. They're essentially a physical manifestation of the internal changes diabetes can cause. While they're generally painless and don't cause discomfort, they serve as a visible sign that something might not be quite right. So, next time you notice these seemingly innocuous spots on your shins, don't dismiss them. They could be your body's subtle way of alerting you to a potential health concern. Those spots on your shins may be trying to tell you something. Last but not least, digital sclerosis. This might not be a term you're familiar with, but it's a skin condition that can be a sign of diabetes. So what is it exactly? Digital sclerosis is a condition that causes your skin to become thick and tight. Most commonly, it affects the skin on your hands, making it feel like you're constantly wearing a pair of tight gloves. This tightness can make it difficult to fully extend your fingers or make a fist. Digital sclerosis is often linked to high blood sugar levels, which is why it's seen as a sign of diabetes. It's crucial to keep an eye out for this condition, especially if you're experiencing other signs we've discussed in this video. Remember, early detection and treatment can help manage diabetes and prevent complications. So if you notice the skin on your hands is feeling unusually tight, it's time to seek medical advice. Tight skin on your hands? It's time to pay attention. So those were the 8 common skin signs of diabetes. Let's do a quick recap. Dark patches, skin tags, and varying shades of yellow, red, or brown patches may all indicate something isn't quite right. Blisters, skin outbreaks, and constant itching could be your body's way of telling you that your sugar levels might be off. Don't overlook shin spots or digital sclerosis. These signs are your skin's SOS, urging you to pay attention. Remember, early detection is key. Regular checkups with your healthcare professional can go a long way in managing this condition effectively. Your skin, like a vigilant sentry, might be the first to alert you to a potential problem. Don't ignore these signs. They could be your first line of defense against diabetes. If you found this video helpful, don't forget to like it and subscribe to our channel for more informative content. Stay healthy.